Good afternoon, sir.
Hello, Wasim?
Yeah, good afternoon, sir.
You have to unmute. We are not able to hear you. Unmute, please.
Sir, 1 minute, sir. Unmute. Sir, now, are you able to listen to me? Good, yeah, good afternoon, sir.
Hello, Wasim, how are you?
Yeah, fine, sir.
How are you?
Fine, sir.
Okay, good, Wasim. So please introduce yourself briefly.
Sir, myself Wasim Hussain Bhatt and I am from Jammu and Kashmir, India. I recently completed my PharmD from Rajiv Gandhi University of Health Sciences, Bangalore. And till now I have published a total of 8 research papers and 1 review articles. Yes, sir.
Very good.
Yes, sir.
Okay. So what was those research papers on?
Sir, about those research papers, one was experimental studies titled as Evaluation of In Vitro Anti-Diabetic Activity Using Silver Nanoparticles of Gallium Sugar Pluriflora. And others was prospective observation studies, that's clinical studies. And this previous one was experimental study.
So were you the first author of any of those papers?
Sir, what, sir?
Were you the first author in any of those papers?
Yes, sir. I contributed as a main author, sir, and I contributed as framing the titles, collecting the data, interpretation, all these things I did myself, sir.
Okay. So can you talk to me about any one of those studies which is very close to your heart? Pick any one of those papers and then we can discuss about it.
Sir, one of the important research I did about the evaluation of in vitro anti-diabetic activity using silver nanoparticles of gallium sugar pluriflora by using averted gut sac method using chicken ileum. So, sir, it was in vitro anti-diabetic activity, in vitro experiment.
So how did you demonstrate anti-diabetic activity in a chicken ileum?
Sir, as this gallium sugar pluriflora is well-known traditional plant for having traditional medicinal properties like hypoglycemia and other anti-inflammatory properties. And we assumed that it may inhibit alpha amylase enzyme and alpha glucosidase enzyme and inhibition of glucose uptake. So this alpha amylase inhibition and alpha glucosidase inhibition, we did it by the principle of calorimetric methods. And this glucose uptake, we did it by averted gut sac using chicken ileum.
So you were the first author in this paper?
Yes, sir, I am the first author.
So can you tell us anything about, can you pick any of your clinical papers?
Sir, yes, sir. Yes, sir. One of my clinical paper was prospective observation studies for the morphological prevalence of anemia in a tertiary care setting.
So prospective observation study
For the
to detect prevalence.
Yes, sir. Morphological prevalence of anemia.
In what type of patients?
Sir, in general study, in all types of patients.
No, was it in patients attending the hospital or was it in general population?
Sir, it was in patients admitted to hospital. And sir, another type of study.
So what was it?
Yes, sir.
What were the main findings of that study?
Sir, the main findings was that normocytic normochromic anemia is the most prevalent form of anemia in individuals with CKD or any other any metabolic disorders like chronic conditions. So normocytic normochromic anemia was the major morphological pattern seen in this paper, sir. And comorbidities. Yes, sir.
Go ahead.
Yes, sir. And comorbidities and advanced age, it was the most risk finder, most important risk finder, which we find it.
Okay. So how many patients did you enroll for this study?
Sir,
and how did you calculate sample size?
Sir, in this paper, We a total of 100 patients were included based on some criteria, and sample size we calculated by random sampling method, sir. Random sampling method. We took some samples and evaluated the morphological prevalence by random sampling method, sir.
So when you say that total age and comorbidities were the contributing factors,
Yes, sir.
how did you establish that? What kind of statistical test did you use to demonstrate to establish that?
Sir, we took all the lab parameters like CBC. We took CBC, and we took the patient histories. Yeah, if there was any comorbidities, like it was mentioned on the detailed patient profile. So we took all the data and analyzed later on. So then I found that comorbidities and advanced age, it's one of the major risk factors which was found in anemic patients.
So what kind of statistical test did you apply to come to that conclusion?
So statistical test, we did t-test. Not the t-test, ANOVA, we did ANOVA. Because t-test, it is for limited sample, it is for up to 30 samples we can assess t-test. Then we did ANOVA, sir, ANOVA. ANOVA we can use up to more than 30 samples, and t-test is limited only for 30 samples, sir.
Okay, that's not the case.
Yes,
Okay,
sir.
you have to read up a little bit. Okay,
Yes, sir.
that is not the case.
Yes, sir.
Okay, are you familiar with adverse event monitoring or therapeutic drug monitoring or something like that?
Sir, actually, I'm not getting it. Voice is little bit breaking, sir.
Are you familiar with adverse event monitoring?
Adverse event monitoring, yes.
ADR monitoring.
Yes, sir. Adverse event monitoring. During our internship, sir, we did some study about adverse drug event monitoring. Like for digitalis, it was one of the narrow those drugs which was narrow therapeutic index. For that drugs we did some therapeutic drug monitoring. But some oncological drugs, it was not. We didn't did therapeutic drug monitoring because it's not necessary for oncological drugs to do therapeutic drug monitoring, sir.
Is not necessary. Why? Why do you say it's not necessary?
Because, sir, therapeutic drug monitoring, we usually take the samples from plasma, sir.
Okay.
Yes, sir. And yes, sir.
No, but oncology patients do not have plasma.
Yes, sir. They have plasma, but usually we don't take, sir. We don't do therapeutic drug monitoring for oncological cancer, chemotherapeutic patients, sir. Usually. We may do, sir, like for cisplatin or some other drugs we may do, but usually we are not doing TDM for chemotherapeutic drugs.
So what are the different ways in which you can assess the causality of an adverse event to a given drug? So like for example, there is an adverse event happening.
Yes, sir.
When a patient is taking a drug.
Yes, sir.
How do you do the causality assessment?
Sir, we have different scales. That we have Naranjo scale, we have WHO World Health Organization scale. Based on that, we calculate the score and find out the probability or assessment of adverse drug event.
So now, very good answer.
Yes.
So now, what are the criteria that are used to establish causality?
Sir.
So in Naranjo, if you look at Naranjo scale,
Yes, sir.
what criteria they use to establish causality?
Sir, they used some scores like 0 to 10. They used score 0 to 10, and in 0 they have given some questionnaires like probable, and like these questions they have given. And if we find that answer, we will give the score +1. If not, then we will. Yes, sir.
Correct. Those questions that you're talking about.
Yes, sir.
What are those questions framed on? What are the aspects on which those questions are framed?
Sir, I know few questions. I don't know complete questions. I know some few questions. I will answer that. Sir, first,
Whatever you do, then
sir, some questions in that Naranjo school, Naranjo scale it was. Sir, first one question is any previous drug they have taken, any previous drug, or any there is any comorbidities or not, or any previous drug they have taken or not, and further they will say first when we have given this medicine, the reaction occurs before or not, and when we stopped the medication, does the reaction stopped or it remained? Yes, sir. Yes, sir.
very good.
Yes, sir.
Okay, nice question. So maybe I request my colleague Dr. Bhaskar, if he's there, to ask you a few more questions.
Yes, sir.
Dr. Bhaskar, maybe he ask you a couple of questions
Yeah, good afternoon, sir.
because you always spend.
Yeah, am I audible?
Yeah, good afternoon, sir. Good afternoon, sir.
Yeah, I'm audible?
Yes, sir, I am audible, sir. Good afternoon.
Yeah, good afternoon. Oh. So, tell me, have you heard about tyrosine kinase inhibitors?
Yes, sir, these are kind of targeted chemotherapies like imatinib, nilotinib, dasatinib. We have example of these. So these are targeted chemotherapies, sir.
Oh. So, what is their advantage over conventional drugs, conventional anti-cancer drugs?
Sir, the main advantage of these tyrosine kinase inhibitors, they don't have like main toxicity like as alkylating agents are having. They usually
Okay.
target a specific antigen or enzyme, and yes, sir, and contribute their this antineoplastic or chemotherapeutic action.
So, can you name the indications where they are used?
Sir,
The
one.
individual drugs?
Sir, like imatinib, this is tyrosine kinase inhibitor. It's one of the drug of choice for chronic myeloid leukemia. Yes, sir.
Okay.
Yes, sir.
Any other examples?
And sir, other we have like we have regimen, some regimens like Folfari regimen. In that we are using bevacizumab. Bevacizumab, that's also tyrosine kinase inhibitor. We are using for Folfari.
Okay.
Yes, sir. That's for colorectal cancer, sir. Colorectal cancer.
Oh.
Yes, sir.
Can you name any monoclonal antibodies which are used in cancers?
Sir, like trastuzumab, or we have trastuzumab, staclizumab, rituximab. Yes, sir. We have so many monoclonal antibodies.
So, what are the problems associated with monoclonal antibody use?
So monoclonal antibodies, the major problem is we have anaphylaxis reactions. We have anaphylaxis reactions, hypersensitivity reactions are usually there, which is one of the main problem. And sometimes resistance also may occur, sir. Sometimes resistance. Yes, sir.
So, can you prevent these hypersensitivity reactions?
Yes, sir. Sir, we can treat. Usually, we can do symptomatic treatment by
Prevention.
preferential, sir.
How can you prevent?
Sir, we can.
How can you avoid?
Yes, sir. We can prevent if we can, sir, give pre-treatment of like steroids, dexamethasone or prednisolone or H1 antihistaminicus, then we can prevent it, sir.
Oh,
Yes, sir.
oh, fine. So, since you have worked in anti-diabetes,
Yes, sir.
so can you name any anti-diabetic agent which is being repurposed for cancer?
Which is used for cancer, sir. Huh? Sir, this as I did my experimental like about the Calcium parviflora. When I checked the literature, it's also used for anti-cancer. It's having also some anti-cancer activities.
Okay. Among the what you call the medications that are already approved
Yes,
for
sir.
diabetes, any of them has any anti-cancer activity or supposed to have any anti-cancer activity?
Sir, I don't know, sir. Maybe I'm not. Yes, sir.
No problem.
Yes, sir.
No problem. Any group of anti-diabetics you know which increase the risk of a particular type of cancer?
Sir, actually, usually we have sulfonamides.
sulfonamide or some other.
Related?
Sir, also we have pioglitazone, sir. That is pioglitazone. We have all these drugs. I think they may contribute carcinogenesis, but I am not sure, sir. Yes, sir.
Any associated with thyroid cancer, medullary carcinoma of thyroid?
Sir, medullary cancer, we have this anti-arrhythmic drug, one of the anti-arrhythmic drug that is anti-arrhythmic drug, that's type 3 anti-arrhythmic drug that can cause sir, hypothyroidism and sir, but usually cancer, no.
Okay, no problem.
Yes, sir.
That's all from me. Thank you.
Thank you, sir. Thank you, sir.
Good, Ratan. So the fellowship will start from 1st August.
Yes, sir.
If you are selected,
Yes,
you
sir.
able to join from 1st August.
Yes, sir. Sure, I will join, sir. I am passionate because, sir, I am passionate about chemotherapy and clinical pharmacology. I want to contribute. Yes, sir. I want to contribute.
All the best to you.
Thank you, sir.
You will have a okay.
Thank you, sir. Thank you so much, sir.